Thank you, Mr. President. Good morning, colleagues. Happy sunny day. A few minutes ago, I spoke with concerned current and former Centers for Disease Control and Prevention employees who have come to the Capitol to sound the alarm on the destruction of their agency. The underlying foundation of the healthcare system that each of us depends on every day to prevent illness, manage chronic conditions like asthma and diabetes, and bring breakthrough, life-saving treatments is being butchered and dismantled. In February, President Trump ordered the indiscriminate firing of nearly 1,300 CDC employees, gutting 10% of the agency's workforce. This week, another 2,400 jobs, at least, were slashed. Some say it's a RIF, or reduction in force, but in many aspects of the agency, can be more accurately called an EOF, an elimination of the force. These numbers represent years of investment in study and training for programs that protect every single one of us from disease outbreaks and public health threats. Programs that track and prevent asthma, smoking, gun violence, climate change, and other health threats. The National Institute for Occupational Safety and Health is almost completely gone. One example is tuberculosis, which is on the rise worldwide. It has not been in the United States so far, but that is because of the CDC. But with 1/4 of the workforce at the National Center for HIV, Viral Hepatitis, STDs, and TB prevention slashed, we will soon see those disease rates increase, just the way measles has this year, with misinformation spreading about public health from the top. Let's note that chronic disease prevention funding is almost all federal. That includes maternal mortality and excessive alcohol use prevention, among other programs. Over half of DPH's budget is federal funding. Severe cuts have been and will be made here due to this slashing. Our Georgia Public Health Lab has already lost over half of its staff due to these federal funds. 23 attorneys general have filed a lawsuit to try to block this decimation, but with too many in the Republican Party captive to Trump and co-President Musk and their destructive agenda, it's not surprising that Georgia has not joined the lawsuit despite the illegality of these actions and the harm to our citizens here in Georgia. The CDC is a federal agency, one of a very tiny number that is based outside of Washington, D.C., and we have always been proud to have it based here in our capital city. Former staff and concerned citizens have marched and protested outside of the CDC headquarters many times already in the last several months. Today, many of them came to the Capitol to sound the alarm, and I urge all of my colleagues to listen to what they are saying and to the warning signs. The truth is that when it comes to health, every single one of us is connected. And having the CDC has always been a point of pride for Georgia. I've been very proud to represent it and many of its employees here in the state Senate. But today, I and all of us should be grieving the loss, the decimation of this jewel of our nation and state that has led the world in disease prevention and saving lives. I'm very alarmed, as every American should be, about what's to come when the next epidemic, pandemic, or disaster comes home to roost. You can bet that we will be far more ill-prepared. And when the time comes to try to rebuild what's been destroyed. Who will foot the bill? I doubt any of the billionaires currently running our government and putting in special favors for themselves will be asked to foot the bill to rebuild the public health agencies that serve all of us. Instead, it's also probably another safe bet that regular Georgians and every working American will be the ones footing that bill. Thank you, Mr. President. I yield the well.
Thank you, Senator.